Hi there. My name is Anton ZIska. I'm doing my policy presentation on Ordinance 1037-010. This presentation is for the addictions class at Heritage University in Yakima for Professor Dr. Amy Nusbaum. So let's begin. So this is a general overview of what we're going to be going over today. We're going to start with an overview of this ordinance 1037-010, the impact that it has on its community. Specifically today, we're going to be talking about Everett, where this ordinance originates from, some research on policy impact, SOTA and other jurisdictions. SOTA is an acronym that we're going to get into briefly. Some strengths and weaknesses about this ordinance, looking at it from a therapist and counselor perspective on interventions and advocacy, what we can do here and how we should view this ordinance, and a personal opinion as a up and coming therapist. Where do we go from here? So I'm going to provide a brief overview of this ordinance 1037-010, and this will involve a little bit of reading off of the screen. But in the municipal of Everett, Washington, it is unlawful for any person to loiter in or near any thoroughfare, place open to the public, or near any public or private place in a manner and under circumstances manifesting the purpose to engage in drug-related activity, contrary to any of the provisions in other RCWs from the city of Everett. So essentially, this ordinance is something that created a stay out of drug zone or stay out of drug area. Stay out of drug area stands for SOTA, which is one of the acronyms that will come up a lot in this presentation. The first SOTA area came up in 2007 in Everett, and now Everett is up to 9 designated SOTA sites. This ordinance is particularly for those who have been known as unlawful drug users, possessors, or sellers. And this means a person who has, within the knowledge of the arresting officer, been convicted in any court within the state of a violation involving the use, possession, or sale of any illicit substance, or a person who displays some physical characteristics of drug intoxication or usage. This can include needle tracks, possession of drug paraphernalia on them or on their body, or behaving in a suspicious manner that presents that they have been intoxicated or have been using. Some examples that were brought up in this ordinance include people who are in these areas are on the lookout, take flight when a police officer shows up, or if they conceal themselves or the objects that they are possessing when an officer shows up, or if they're seen transferring some small objects or packages in a suspicious fashion. Additionally, this ordinance is directed towards loiterers who are physically identified by police as being members of a gang, people who have been identified by police as associated with the presence of illegal drug activity, or if their vehicle has been identified by police historically as being unlawful drug users, possessors, or sellers. A person guilty of violating this provision, so a person that fits this ordinance and is found in a SOTA area when they're not supposed to be, might be guilty of violating or they will be guilty of violating this provision, which will be a charge of a gross misdemeanor. So that in the city of Everett is a maximum penalty of 364 days in jail and or a $5,000 fine. So again, ultimately through this ordinance, the person is currently prohibited from being present in the designated high drug activity geographic area. So here I have a few maps that come from the City of Everett Police Department. Starting with the middle map, this middle map includes offenses that have been, or drug-related offenses that have been seen from January through December of 2020. Offenses include instances where arrests were made, instances where there has been a recorded documentation of drug-related activity, but not necessarily a criminal charge that was pursued, but that a call was made. The Everett Police Department has been asking the city council to keep its 9 stay out of drug areas so that people who have been arrested for drug crimes would not be allowed there. So now we're going to look at, so after 2020, that's when um, the thought and implementation of soda started, or the 9 soda locations started to increase. So looking at the left map includes calls for services in 2021. In this map, there are 1,958 total calls, both by officers and 911 complaints, coded substance. Um, and as we see in the right map, by 2022, the number of calls jumps to 3,073, both by officers and by 911 complaints coded in substance. So we see that this area highlights all of the 9 soda maps that are wanting to be kept by the city of Everett. These maps show that there's also or that there is a heavy concentration of calls for services and arrests related to substance use in these 9 stay out of drug areas. Um, kind of like what we from an expansion of what we talked about in the previous slide. According to some city data, fatal and non-fatal overdoses hit a 3-year high just halfway through 2023. In 2021, there are about 90 reported incidences. In 2022, it did drop. It dropped to 72 um, overdoses, but by the middle of 2023, only May of 2023, it had already jumped to 95 fatal or non-fatal overdoses. So it isn't showing that there's an increase in, or that there's a decrease in overdoses or safety. In fact, it's showing the opposite. Substance use did grow, or substance use reports did grow despite these zones still staying in effect. Um, Something that was really important to note too was that all of this came in the wake of the 2021 state Supreme Court ruling called the Blake decision. So now the Blake decision uh, ruled that police cannot arrest people for simple drug possession in a state law that requires 2 documented jail diversion programs for at least the first 2 arrests. And this did lead to a plummet of arrests between 2021 and 2022. Um, However, the increase of soda area with the increase of soda areas, these arrests drastically increased again. And a lot of this is because people had gone through these programs already, through the diversion programs, and had more misdemeanor drug possession arrests during that period of time. So they were considered frequently contacted. Um, so despite the Blake decision, they surpassed the number of jail diversion programs that were required by the Blake decision and were ultimately arrested again and charged for drug possession. Uh, this, yeah, and people who are specifically working within SED services or leading addiction recovery programs have been criticizing these proposals and these soda zones for a long time, stating that people who are seeking SED services are being pushed farther away, potentially into residential areas, which is something that we're going to continue to talk about. I'd like to get into a little bit of policy research as well. So there was one study called Banish, the New Social Control in Urban America, that explored the exclusionary zones, uh, having soda in cities such as Seattle, such as Everett, was seen as counterproductive, not just through interviews, but also through qualitative research or quantitative research. Interviews with the Banish themselves revealed that exclusion, exclusion in general, especially exclusion from these public spaces, made their life and the pathway to self-sufficiency much more difficult. The research was demonstrating that um, the thought was there. You know, police and public officials appear to be responsive to these concerns, of urban disorder, but it was for the most part a highly questionable policy. It was ultimately expensive, it didn't reduce crime, and it did not address the underlying conditions that generated urban poverty in the first place. During SODA's previous run, because this isn't the first time that SODA has been implemented, it has been tried before. Um, During SODA's previous run, uh, clients in rehabilitation and methadone clinics were arrested simply for transferring buses in a prohibited zone. Others were issued SODA orders, um, and were grappling with the threat of homelessness if these shelters where they were potentially able to get housed were suddenly in off-limit areas. So they would risk being arrested if they were to go to their homes or go to places where they frequent for treatment or for housing. They ultimately chose homelessness instead. Moreover, there were others who were arrested for violating SODA orders when they were on their way to court. Additional research that came from Seattle's attempt of SODA back in 2000 showed that during the first 3 months of SODA's original implementation in Seattle, Washington, over 50% of those who were arrested for drug loitering were actually African American. Less than one-third of the arrests led to actual charges, but this did show racial discrimination and disparities in how they're being treated by police in Seattle, specifically when it comes to substance use in Seattle. And I thought an interesting quote from the study too was that the implementation of this was kind of used as a device to remove the young black males from downtown Seattle in order to create a more orderly appearance to downtown shoppers. Soda is also implemented in many other cities in this area. Another one example is in Kent, Washington, the RCW 69504013, which states that those who are possessing or using substances are prohibited from certain areas. And it specifically prohibits the use of controlled substances which are not in the original container that it was prescribed in. Seattle has its own soda. Um, And I highlighted that in the map below, showing the downtown soda as well as the Chinatown International District soda. A person in violation of this order is subject to arrest under Seattle Municipal Code. Um, but also, again, just like Everett's, it doesn't address the underlying causes or reasons for substance use, or harm caused by substance use. So Seattle had an urgent need for comprehensive strategies to address the growing drug crisis. But despite having soda in major downtown areas, Seattle still saw 763 drug overdose deaths, which in 2023, which is ultimately over half of all of the deaths related to drug overdose in King County. Um, these fatalities were in very specific areas and led to an increase of property crimes and violence. Finally, Pierce County also has their own soda. It's called Drug Area Off Limits Order, which means that any written order by any court of competent jurisdiction that enjoins a person from entering or remaining in a designated area of drug activity. Now, soda ordinances were introduced for a reason. There are strengths while there's also weaknesses. Some of the strengths include gun violence, crime, and disorder, which were seen in Everett as increasing, and there was a necessary action that needed to be done by the city. The Smith Avenue in Everett did ultimately see fewer drug incidences after countless enforcement operations, according to a news article from the Herald in 2023. And they did see a decrease in drug overdose in an area as a result of a decreasing supply in the area. There are definitely weaknesses to this ordinance, though. Um, it bans people who are charged with drug-related offenses from entering certain public zones. And the key word here is charge. It does not necessarily mean convicted in court. But if they're charged with a drug-related offense, that is enough for them to be banned from a soda area. It ultimately deepens isolation and criminalizes survival. And this increase of policing is really damaging for an already over-surveilled community. It historically has been proven ineffective. This isn't the first time that Everett has implemented soda areas. They've already tried it in the past, and it has shown to not work. And it does ultimately disproportionately affect racial minorities and houseless populations. City of Seattle has detailed some racial equity toolkits to see if soda ordinances does disproportionately affect populations, but they are not planning on implementing these until late 2026. I want to take approach as a therapist and as a counselor, how we can intervene and how we can advocate for our clients who rely on services or rely on needing to go through or to soda areas. How can we best help our clients and promote their safety? So first we educate them on their rights and inform them about what areas are impacted by soda. We provide a trauma-informed and culturally competent, holistic advice to individuals who are at higher risk of receiving discriminatory services from law enforcement. And this especially includes patients who have historically been marginalized um, within behavioral health services or have behavioral health disparities. We should provide harm reduction strategies to connect clients to harm reduction and mutual aid groups in their cities. Now, in this case, harm reduction does not necessarily mean reducing their substances, unless that is their explicit goal. Harm reduction means reducing the amount of harm that is done or that is caused to them as a result of their substance use. And in this case, it means increasing safety and awareness about the environment they're in and the risks of using in certain areas. Um, as therapists, we are able to advocate beyond the clinical room. We're able to attend city council meetings to voice our concerns. We're able to push for care-based solutions, not carceral responses. And we're able to center the lives of those who are directly experiencing these policy decisions. Where do we go from here? This is a personal response to soda. So soda areas are often and unironically located in areas that are dense with behavioral health services, substance use support, housing services for at-risk and vulnerable populations, and employment and legal aid services. It has been seen, especially because of the areas that they're in, that it does disproportionately impact BIPOC populations and historically has. It creates this freedom of movement creates dangerous rhetoric, turning drug users into the social scapegoat, further marginalizing them or further marginalizing an already marginalized population. By turning them into the social scapegoat, it blames them for the city's social ills rather than addressing the problem and helping them. By othering them, it targets them and objectifies them, drug users, as the other, which separates them from the public or from the citizen. Um, and it just pathologizes these people that are going through difficult chapters and trying to survive, really. It polices and segregates them in order to reduce disorder in public spaces, but it isn't creating any viable solutions. It's just creating a social harm instead of a social good. Ultimately, my opinion is that safety comes from improving funding for social service resources, and creating systems where recovery is possible and where they're able to use safely and have the services that they need in order to meet their personal goals, centering the lives of those who are most directly impacted, those that are most marginalized in our society. With that, I want to thank you for watching this presentation. Here are some of the references and resources that I highly recommend exploring. And thank you again.